Hello, this is Dr. Adam Kopsky from Advanced Rehab and Medical. I hope you guys are having a great start to this week. I just wanted to come on and tell you a little bit about our topic this week. It's a very good one on what can be done for kneecap pain. So a lot of you that are suffering from knee pain, there is hope, and I just want to give you a little information about what typically causes knee pain if it's not due to a trauma. So a lot of times, even though you may be having knee pain, the actual cause of your knee pain is typically coming from up higher in the chain, either from a hip weakness or down in a lower chain due to your foot caving in, which we call as hyperpronation. So a lot of times women are more prone to this just because they have typically a wider pelvis due to the birthing process and how they're typically built. So a lot of times what happens is with the wider pelvis and this hip weakness that comes on, the hips will start caving in, and as you can see, that adds a lot of undue stress to the inside of our knee. So typically when we get this knee pain, it's typically to this inside portion of it, and it kind of strains a lot of the muscles and ligaments in that area. So typically MCL is most vulnerable. And that also, if the hip is not the case as the chief area of complaint of causing this knee pain, then we can also look at the foot. And as you can see, if my foot starts rolling in here, then that's going to start putting a lot more stress on that knee. So the knee is just more vulnerable because it's as the center point from the foot and hip, and so it takes a lot of that stress. So it was funny in this good handout, they examined some research, and what they found was those that targeted hip muscles to strengthen the hips and the quads got better results from improving knee pain and improving their function. So more as than just targeting the quads. So I just wanted to, and I know it sounded like a broken record on the hip weakness because I came on a couple weeks ago and showed an exercise. So I just want to show two quick exercises that can target to strengthen the hips and the quads and hopefully improve your function in the knee and also get you into decreased pain levels. So the one thing I wanted to show here is before I showed a single-legged squat, which is great. If you can't handle that, what you can do is just come out a little bit from the wall if you have a wall at your home, and you can do just a wall squat. So you just come down just until your butt touches the wall, and you come back up. And you just kind of come down. Of course, if you have too much pain with that, don't go as far there. And try to do about 3 sets of 10 twice per day. You know, once when you get up in the morning, once in the evening. And that'll really start targeting those quads as well as those butt muscles and hip external rotators. Another one that we can do, as far as the second one that's real easy, is called a clam. So if you get in a sideline position, what you try to do is just come up, and we're just going to kind of make a clam here. And so when you come up here, just come up at a count of 1, 2, and then really on the eccentric on the way down, we really try to start holding it as a count of 4 seconds. So 1, 2, 3, 4, and that really is a good exercise to help target those external rotators of the hip and help strengthen those hip muscles and take a lot of pressure off that knee. However, if you notice, if you look at your feet and you have flat feet, we do offer foot orthotics, and those can be a good option as well if your pain is coming from your foot and you know you have foot issues. So anyway, I hope these tips were informative, and I look forward to seeing you guys in the office this week, and have a great rest of your week.